Hello, my name is Christy Bundu Kumar. I'm a psychiatric nurse practitioner with a doctorate in healthcare education. I'm the medical and research director for the Realm of Caring. But more importantly, I'm a mother of 2 children on Charlotte's Web. They both have a neurodegenerative condition called DERPLA, which includes seizures. We have had a 50 to 70% reduction in seizures and immeasurable improvements in quality of life. The Realm of Caring is a not-for-profit that is formed to provide better quality of life for individuals with debilitating conditions. The website is therock.us. Please get on there, familiarize yourself with that, specifically the client portal, how to talk to your doctor, provider's guide, and the calculator, which we'll all go over. And hopefully we'll have some good educational resources for you on there as well. The REALM stands for Research, Education, Advocacy, Improving Lives Through Measurable Results. As you can see, Zakai here is 2 years seizure-free, and we want to not only change people's lives, but have research to back up the efficiency of that. We have literature reviews, a research registry, and currently trying to get funded for clinical studies. We will take every opportunity to provide education and promote change through our advocacy. As you probably know, Charlotte's story is she was the first pediatric patient, what was then called Charlotte's Web, part of the medical marijuana program of Colorado. She went from 300 seizures and hospice care to a very vibrant child hitting developmental milestones. More about Charlotte's story can be found on our website. Charlotte's Web hemp oil is a 30-to-1 ratio, that's CBD to THC ratio, comes in a bottle of 50 milligrams per ml. It is certified by the Colorado Department of Agriculture as hemp, and we believe it is Farm Bill compliant. It is the same genetics and processes that Charlotte has used for 2 years. It is important to reiterate that Charlotte's Web hemp oil is the same plant and has always classified as hemp, but only recently was there a legal way to grow it as hemp. Charlotte's Web hemp oil is 30-to-1, as I said, and your bottle is a 50 milligram per ml. Now, the Observational Research Registry, which everyone will be asked to participate in order to be Farm Bill compliant. So when we say the Farm Bill, in 2004, the federal U.S. Department of Agriculture said that industrial hemp can be grown and cultivated if it is used in research. And so you are going to participate in the observational research and be able to be Farm Bill compliant. And it will also give us a plethora of information as we move forward with thousands of new starts. So the research registry will look like this. You will register, and it'll come up. You will do the CBD online consent. You can view mine. I registered my child, and so the consent is here. And then the actual registry, the first time you participate, the baseline form, it's close to 200 questions, so be prepared, but you can save and go back. We want to get a solid information there. And then each month as you reorder, you will be asked to fill out a monthly reorder form for the observational research. So, what do we know about the endocannabinoid system? It was described in 1992, and you can see that there's been a lot of research conducted. Here on PubMed, you can find in the title an endocannabinoid system, over 594 studies, either describing or trying to identify the role of the endocannabinoid system in disease, wellness, and health. And so I encourage you to get in and begin to research the endocannabinoid system and what that means for your specific symptoms. So the mechanism of action of CBD on health is still unknown. But here are some potential effects that some of the research has identified. CBD acts as an indirect agonist on the CB1, CB2 receptor sites, and it could actually be an inverse agonist on CB2. It also somehow manipulates the 5-HTP1 receptor, which helps with depression and anxiety, or it's at least the receptor that we use in some of those antidepressant medications. Upon other receptors, it can be a neuroprotectant. It works on the opiate receptor, so it can help in withdrawal of opiates. CBD may actually reduce the symptoms of psychosis on the NMDA receptor. It also manipulates or modulates GABA, which is our control neurotransmitter, and has also, in a small study, shown increased blood flow to the brain. So how do we dose Charlotte's Web? The starting dose is between 0.25 and 0.5 milligrams per pound, and that depends on if you're sensitive to medications, or if it's a child and fragile, we would suggest that you start at 0.25 milligrams per pound, increasing every 3 to 4 weeks to an optimal dose of what's being reported is about 2 to 4 milligrams per pound, but we have some clients as low as 0.25 milligrams per pound as their daily maintenance, and we do have some higher as well. So how do you do that? Here's the formula, and it's basically your weight times your dose divided by the milligrams per ml that are in the vial, and that's going to give you your milliliters per day. Then you're going to divide that by 2 or 3 doses per day. That's going to give you your milliliters per dose. So we are working on a dosing calculator on the Realm of Caring website in the client portal. So, for example, if I were to put in 150 pounds, my 14-year-old daughter is 150 pounds. Her starting dose would be 0.5 milligrams per pound, and then it gives you a daily dose of 75 milligrams. We will also tell you how many mLs that is and how many mLs that is in the 2 to 3 divided doses. It will also give you the amount of milligrams that you'll use in a month to help you know how many bottles of oil to use. But I don't want you to rely completely on the dosing calculator. I want you to understand the math, which for some people is hard, but the formula is right here. So, for example, my son is very fragile, and actually his maintenance dose is 0.25 milligrams per pound. He weighs 80 pounds, so we're going to, in our calculator up here, we're going to put 80 pounds, right? And then the formula says times the dose, right? His dose is 0.25, okay? And that equals 2. No, let's try that again. 80 milligrams times 0.25 is 20. See? Always be able to go back and check your math. So 20 milligrams per day. And so if you have a 50 milligram solution, so you're going to divide it by 50. That's going to give you 0.4 milliliters in a day. So if you were going to do it by 2 to 3 doses per day, so if you're going to dose it twice a day, you divide it by 2. If you're going to dose it 3 times a day, you divide it by 3. So if we're going to divide it by 2, say we're going to dose it twice a day, that's going to be 0.2 mL. Now, let me just show you 0.2 mL. So this is the oil. You want to make sure that you shake it very good because it can consolidate down at the bottom. So you shake it well. You use a 1 mL syringe, okay? And you're going to pull up, I said 0.2, right? So go like this. and 0.2 is that small amount, okay? And we dose it sublingually under the tongue. Let me minimize myself again. Okay, so hopefully that this is beginning to make sense. Now, if we were to do that, let's say we said 0.4 mLs per day for my son's daily dose. If I wanted to dose it 3 times a day because I felt like he was having seizures in the middle of the day, or there was something, the symptoms were coming back in the middle of the day and I needed to increase the dosing, you would divide that by 3, and it comes up to 0.133. So again, looking at your syringe, you want to make sure that 0.133 is just past the 0.1. Okay, it's a very small amount. So mLs are your liquid, mgs or milligrams are the amount of CBD in that liquid. Okay. Let's do one more. Okay, so my daughter, we started her off at 0.5 milligrams per pound. She's systemically healthy. She responds okay to medication. She doesn't have weird reactions. So we do 150 milligrams times the 0.5, because here we started either 0.25 or 0.5. That's going to give me 75 milligrams per day that she would take. So if I divide that, right, the next step is divide by 50 milligrams per ml. So I'm going to divide by 50. That gives me 1.5 mLs per day. Okay, so I'm going to do it in 2 doses. So I'm going to divide that by 2, and it's going to be 0.75 mLs per dose. So I'm going to do it twice a day, and it's going to be 0.75. Okay, so my daughter's bigger, and she's got a larger dose, so that's going to be more fluid, right? More liquid. So remember, shake the bottle well, and then the 0.75 is about that much for a 150-pound child starting at 0.5 milligrams per pound. Minimize myself again. Okay, so that's how we dose. There is a provider's guide in the patient portal that I want you to make sure that you share with your provider. It gives a guide. It gives the mechanism of actions for your provider, the therapeutic benefits, how to administer, and the dosing. The dosing that I just described is here, as well as how it's metabolized, special precautions, and interactions. An important thing here is the interactions. Okay, CBD is a CYP-C19 inhibitor, which some medications use that as a metabolite, and your doctor will understand what this means, but it's very important that you share this with the doctor. So if you look at this chart here, these are potential interactions with anticonvulsant medications. Your pharmacist can give you something like this in reference to the medications that you're on. If you're on pain medications, antidepressant medications, different medications. This happens to be just for anticonvulsants, but it tells you where CBD and what it can do. So here, if you see clobazam, which is Onfi, it increases the decylmethylclobazam level. That's the pre-metabolite level, and actually can cause some interactions and side effects there. So these are things that you really need to make sure that you're sharing with your provider. We encourage frequent monitoring by your provider, including baseline treatment medications. Transition bottles should be When you're going from one bottle to the other, some children, fragile or sensitive children, have trouble transitioning from one bottle to the other. So we encourage you to take 1-2 mLs from each bottle, mix them together so that the transition is smoother for the child. So administration. The best bioavailable administration is sublingual, which means under the tongue. If the child can hold it under the tongue, that's the best. Even if you just get it in their mouth, then they can swallow it. Some children, you can't do that. They aspirate or they can't tolerate the taste. You can put it in capsules. You can buy capsules at your local Whole Foods or health food retail store, and you can put the solution inside the capsule and they can swallow that. But the best bioavailability is sublingual if they can handle that. It can also go in your G or J tubes, and some people do rectal administration. So I just put a picture of the syringes here. These are the different size syringes that are available, but most of you will be dosing so small that you will be using this syringe, the 1 ml syringe that I use to pull up the 0.1 and 0.2 and even 0.75 for my older daughter. So we encourage you to use the smaller syringe. Okay, so questions, educational and research questions are addressed to the realm of caring. We can't give medical advice, but we will provide education to you and even to your providers. We will do patient consults to your provider and provide different educational resources. For quality control questions, you would contact the Stanley Brothers Social Enterprises, as well as questions specific about your order or problems with your order.